The origin of syphilis has been speculated, but the first major presence of the disease was during the 15th century in Europe. Two theories about the true origin of syphilis are called the Columbian theory and the pre-Columbian theory. The Columbian theory states that syphilis came from Christopher Columbus's crew after visiting the New World. This could be from the large exchange of products and goods that were being brought back from Europe. The pre-Columbian theory entails that the disease possibly was around for many centuries, but could have been diagnosed as another known disease during that time. Both theories are plausible and could both be true to an extent. Syphilis could have been around for many centuries, and Christopher Columbus's crew possibly brought back a new strand of the disease from the New World. The name syphilis comes from an ancient myth about a shepherd named Syphilis. An Italian poet and physician first derived the name Syphilis Siv Morbius Gallicus. This was because of the rash/pox that he wanted to distinguish the difference between smallpox and this new disease. It's theorized that syphilis came to humans from cattle or sheep many centuries ago, possibly sexually. Syphilis is a sexually transmitted disease caused by a bacterium. This bacterium causes infection when it gets into the broken skin or mucous membrane, usually of the genitals. Here's an example of the bacterium under a microscope.
The symptoms come in 3 different stages. There's the primary stage, secondary stage, and then the latent stage. So the first symptom is a sore called a chancre. This sore is often painless and sometimes swimming around. It appears at the location where syphilis enters the body. These painless sores can occur in locations that make them difficult to notice, such as the vagina, anus, or mouth. Most people with syphilis develop only 1 or more.
3.
The symptoms come in 3 different stages. There is the primary stage, secondary stage, and then
Latent.
The symptoms come in 3 different stages. So there's the primary stage, the secondary stage, and then the latent stage. So for the first symptom, it's a sore called a chancre. This sore, chancre. The symptoms 3 different stages. So there's the primary, secondary, and then the latent stage. So the first symptom is a sore called a chancre. This sore is often painless and sometimes swimming around. It appears at the location where syphilis enters the body. These painless chancres can occur in locations that make them difficult to notice, such as the vagina, anus, or mouth. Most people with syphilis develop only 1 chancre, but multiple showing up is possible. The chancre lasts 3 to 6 weeks and heals regardless of whether a person receives treatment or not. However, the infection will progress to the secondary stage if the person with syphilis does not receive treatment. And then we move on to the second stage. This usually starts with skin rashes and mucous membrane lesions, such as sores in the mouth, vagina, or anus. This marks the second stage of symptoms. So this stage typically starts with the development of a rash on 1 or more areas of the body. Rashes during the secondary stage can appear when the primary chancre is healing, or several weeks after the chancre heals. It usually does not cause itching, but it may appear as rough red or reddish-brown spots on the palm of the hands and bottoms of the feet. However, rashes with a different appearance may occur on other parts of the body. Also, the rash may be so faint that it's hard to notice. Along with the rash, you may have symptoms such as wart-like sores in the mouth or genital areas. Other symptoms that you might have are hair loss, muscle aches, fever, sore throat, fatigue, weight loss, and swollen lymph nodes. Now we move on to the last and final stage, which this is the latent stage. If you aren't treated for syphilis, the disease moves from the secondary stage to the latent stage. This is also called the hidden stage because you have no symptoms. The latent stage can last for years. Your symptoms may never come back, but without treatment, the disease might lead to major health problems like dementia, heart issues, and then neurosyphilis.
3.
So for the treatment, it's a single injection of long-acting benzathine penicillin G, which can cure the early stages of syphilis. This includes primary, secondary, or early latent syphilis. CDC recommends 3 doses of long-acting benzathine penicillin G at weekly intervals for latent syphilis or latent syphilis of unknown duration. Treatment will cure the infection, prevent further damage, but it will not repair damage already done. As a second-line treatment, doctors may also use another form of antibiotics. People treated for syphilis should avoid sexual contact with new partners until their sores completely heal. They also should notify their sex partners so they can receive testing and treatment if needed. Syphilis is transmitted during oral, anal, or vaginal sex through contact with infectious lesions, and also during pregnancy through the placenta. Transmission typically occurs during early stages of the diseases, which is up to 2 years after infection. You cannot get syphilis through casual contact with objects such as toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, sharing clothes, or eating utensils. Some ways to protect yourself from syphilis are by using condoms consistently and correctly. This is the best way to prevent syphilis and many other STIs. Syphilis can also spread through contact with other areas of the body not covered by a condom, including the genitals, anus, and mouth. If you are in a relationship, ask your partner if he or she has been tested for STIs, and if not, both your partner and you go get tested. People at high risk of infection should be tested at least once a year. Someone who would be considered high risk of infection could be other people who have already had an STI in the past. Pregnant women should be tested for syphilis at the first prenatal care visit and treated right away. If the test result is positive, congenital syphilis can only be prevented by diagnosing and treating the mother with penicillin.
Some facts about syphilis is many people don't notice syphilis symptoms or know they have syphilis at first. And then the third and final stage are the only non-contagious phases of the infection. Having syphilis makes it much easier to get and give HIV. Some well-known celebrities with syphilis are Catherine the Great, King Charles VIII, and Hitler. Al Capone is one, and the 2020 movie Capone shares the last years of Al Capone's life while he suffered the effects of untreated syphilis. And Mary the First is the other. It's theorized that her poor health may have been from congenital syphilis transferred from her mother, who presumably would have contracted the disease from Mary's father. Whether or not he had the disease is debated. However, the story has emerged long after his death. Some statistics on syphilis. The World Health Organization, or WHO, estimates that 7.1 million adults between the ages of 15 and 49 acquired syphilis in 2020. Syphilis in pregnancy, when not treated or treated late with the incorrect antibiotic, results in 50 to 80% of cases with adverse birth outcomes. More than 3,700 congenital syphilis cases were reported in 2022, reflecting an alarming 937% increase in the past decade.